Hello and welcome to our Gold participants from around the world. I'm Fiona Lang Sharp, IBCLC Public Relations Manager and MC for Gold Lactation Online Conference 2016. Well, I have the pleasure of sitting down today with Dr. Tina Smillie, and she's going to be talking about the vicious cycles of slow weight gain, poor appetite, poor feeding, and poor production. Welcome, Tina. It's great to have you here at Gold again.
Hi, Fiona.
Well, I'm excited to have you talk about this. I was reading about this subject matter, reading your abstract, in fact, and I had a lot of aha moments. Very interesting because I think it's something that I've talked about in my practice a fair amount, but I am so keen to hear more from you about this, particular these cycles that obviously we see in our practice but don't always know how to resolve. But firstly, why don't you introduce yourself to our listening audience today? Tell them just a little bit about yourself, and why don't you tell them a little bit about when you first discovered these cycles?
Okay, well, I'm a pediatrician that really only spent about a dozen years doing regular pediatrics half time, and when I then decided to go into breastfeeding medicine before it was ever even called that. And really, very early on in my practice, I was constantly getting stumped by all these kinds of problems that we all run into. And I remember there was this one baby who the mother very much did not want to give the baby formula, and she wanted to pump to give the baby breast milk, but the baby was quite underweight and stuck on a nipple shield. And we were trying to get the baby off the nipple shield, and we were also trying to get the baby to gain weight because the nipple shield seemed to be getting in the way. And so we wanted to get the baby off the nipple shield, but the mother was trying to feed the baby with a supplementer at the breast and with the shield, and it just wasn't working. And she finally, in frustration, herself decided that she was going to give some of this pumped milk by bottle instead of with the tube at the breast. And even I think at one point the baby very soon started acting much hungrier. He was so sleepy before that.
Mm-hmm.
And then when she started giving, she actually, after we'd been struggling for a couple of weeks, she decided that she would try a bottle. And when she did, um, first of all, he started drinking a whole lot more and started demanding a whole lot more, and she had trouble keeping up with him. And so she even gave him a little bit of formula because she was having trouble keeping up with his appetite. And then after she did that, then suddenly he calmed down and he got off the nipple shield no problem. But it was after he was already caught up, he wasn't being so super sleepy, but also in between, he'd gotten really crazy hungry when she'd started giving him milk by the bottle, which now I call a fast flow feeding method. And
Sure.
actually, sometimes a supplementer at the breast can do that too. It really just
Mhm.
depends on the mother and the baby and lots of different reasons why we might use a bottle or a supplementer at the breast. So
Mhm.
anyway, it was that one baby, and in
Mhm.
fact, so many of them that one baby sort of tipped me over into going, aha, I get it. He
Mm.
didn't have the energy to do this, and his mother's milk production had slowed down because he wasn't doing a good job. And I started, as soon as you sort of see something like that, then you start seeing other babies, and it starts, you go, oh, it's the same thing. And so it just changed my practice. I stopped trying to struggle with getting babies off on nipple shields until after they'd caught up on their weight, things like that. So, I mean, every baby story is different,
Sure.
but it's that kind of thing. So,
Well, it's
yeah,
wonderful.
yeah,
Yeah, it's wonderful to hear, and it seems to be true that there's that baby that sort of tips the scales, and we start having those aha moments. But I can,
yeah.
I sense it, I see it, I know it, but I still feel like there's many healthcare professionals that are very complacent with it,
Yeah. Hmm.
and so this is some of the concern now is that we need to go back, do a little bit of rewiring on some of those things and educating to make sure that we don't become complacent as well, and that when we're looking at those babies, we're looking. at all of the factors that are involved,
Right.
and what's happened up until that point, because the history, of course, can be imperative to, of
Yeah.
course, working with
Yeah.
that mother
And
baby.
and really for me, I mean, it's not I don't want people to think that I'm all about the numbers of catching up on weight. It's
Hmm.
really how much work it is for the mother to feed these babies. These mothers are working so hard to keep the babies feeding. And
Hmm.
once the baby is caught up, she doesn't have to work so hard. And that's really the key for me because really, the brain development is usually just fine, even when they're feeding pretty lousily because all the energy goes straight to their brain first.
Hmm.
But those poor mothers are working so hard, and that's the issue for me is to get their life to be easier.
Yeah, absolutely. And I think that's for a lot of us too, where we are trying to make things easier and less of a struggle on for both mother baby. So it's so great to hear your story, Tina, of how it all began. And here at Gold this season, we are celebrating our 10th anniversary. So we're very excited about that. And with that, we have a series going on here with all of our speakers. We've been asking them to reflect back over the last 10 years and just tell us a little bit about what has happened. What has been so good for you, Tina? What have you seen in great changes? What are you looking forward to? And what do you feel is at that cutting edge point now?
Well, for me, I mean, I feel that a lot of things, the clouds have come off my eyes, and I think I have a lot better understanding of what's going on myself, so that when somebody walks in the door in my practice, I tend to get really complicated issues of people that have already seen other people several times, and I'm no longer scared of that. I feel like I can sort of figure it out, and it's challenging, but it's nice to be able to help people out. So on a personal level, I feel like I've just learned a lot from mothers and babies and reading the literature, and also there's more literature out now. So
Mm,
not as much as I'd like, but most of the literature is the benefits of breastfeeding or the risks of formula feeding, and how do we get more mothers to breastfeed rather than really looking at the clinical problems that I'm dealing with every day. But I think the most exciting thing for me, if we look back for 10 years, is that breastfeeding's finally getting a little respect. I mean, the rest of the world is starting to realize it isn't just a lifestyle issue,
mhm,
that people are really paying attention. In our country, the Joint Commission that accredits hospitals has said that it's really important for babies to breastfeed exclusively
mhm,
during the hospital stay. And so they're essentially this very august commission that accredits hospitals is actually pushing hospitals to go baby friendly.
mhm.
So I think that's really exciting that it comes from them and not necessarily from us. So on the other hand, I am a little concerned that mothers are still being pushed to breastfeed for scientific and health reasons, and I would just really like to switch it from this sort of thing about it's the best thing for your baby rather than it's just a wonderful way to enjoy your baby, and let's have it be something that mothers are doing because they want to do it for the enjoyment rather than because they think that it's the only way to be the best possible mother in the world.
Wow, what great answers there, Tina. I was taking notes as you were talking about that. I loved what you said about respect. It seems like breastfeeding is definitely getting more respect, which is incredible. And like you said, the flip side to this is, that we're pushing our mothers now because scientifically it is proven that breastfeeding is best, But I also feel that we're getting, that can have this negative feel to it. A lot of our mothers that are, possibly not able to breastfeed, don't want to exclusively breastfeed, are starting to feel like they have to go in the closet with it because there is so much out there. So there's definitely this balance of how we're going to be respecting the values of our mothers again, as
Right.
we move forward, I think. And that's going to be so important as we take this new age of science into, the next millennium and we look at how we're treating and respecting the mother baby dyad and just teaching them again about loving what they're doing, because that, I feel too, is something that has kind of, in some ways, lost a little of its entity that it used
Yeah.
to have, right? So
Yeah.
great.
Yeah.
That was fantastic. Thank you so much for, just looking back with us as we join together here in our celebration of 10 years. Well, lastly, Tina, I know you have been so busy. I must mention to our audience, Tina's been so busy in the last few days. She's actually coming to us right now from a hotel room, and we so appreciate that you took time out for us today. But why don't you just tell our audience just a couple of things that they have to look forward to with this presentation coming up at the Gold Lactation Conference 2016?
Well, I've given this kind of talk to other audiences before, and I think a lot of people will recognize babies that they've seen, and it sort of helps give you sort of a framework for understanding what's going on. So often mothers feel that their babies are not gaining weight because they don't have enough milk, and in fact, often their milk production has slowed down. But what I really see is that the mother's milk production has slowed down because her baby is so sleepy that the baby isn't doing a good job at the breast. And so her milk production slows down as the result, not the cause of her baby's slow weight gain. And that's really quite helpful for mothers to realize that their, first of all, their milk production can come back, and second of all, that they haven't failed their baby.
Mm.
I guess that's to me, one of the most important things. And then the other important thing is to realize that the babies are not gaining weight, but they're getting plenty of energy to their brain, and it does not affect their brain development.
Oh, that's excellent. Well, thank you. I'm really looking forward to hearing more from you, Tina, at the full conference here. But thank you so much for sitting down with us today and chatting about the upcoming conference.
Good talking with you, Fiona.
Well, thanks everyone for listening in. That's all for now, and we look forward to talking with you again soon. Bye bye.